Hi, everyone. We'd like to welcome you to Real Talk. We're here at Fairview Park Hospital, and we definitely want to bring awareness to Breast Cancer Awareness Month. We've got Mr. Chris Kersey, who is the radiology director here, and we're just so pleased to be here to speak with you today.
It's a pleasure having you.
You know what? We want to know a little bit about you and tell us how long you've been here at Fairview Park Hospital.
Okay.
And we definitely want to know something about this equipment that we're looking at here.
I hear you. Well, my name is Chris Kersey. I'm the Director of Imaging here at Fairview Park Hospital. And I have been at Fairview Park Hospital for 7 years. Been as the director of this department for 3 years. Mm-hmm. Enjoy what I do. I'm very passionate about what I do. We are continuing to see a lot of growth in our department, and the most recent growth is our second mammo unit. Mm-hmm. So we're very excited about that. As for tell you a little bit about myself, I graduated from Heart of Georgia Technical College, mm-hmm. which has most recently been changed to Oconee Fall Line Technical College. Mm-hmm. I completed my bachelor's at Columbia College in Missouri, and so now I'm doing what I love, and I enjoy what I do each day. So
absolutely,
that's me.
Absolutely. Now you talking about you have 2 mammography suites now?
Yes, ma'am. We have 2 mammography suites. The benefit behind having 2 mammography suites is that we are able to accommodate patients on a quicker basis, mm-hmm. in the sense that our schedule can only handle so much in a given day. So by having 2 units operating at the same time, mm-hmm. patients are able to get their exam done quicker. We're able to serve our OB gynecologists much quicker as mm-hmm. well, in the sense that they're able to get their patients in and have appropriate follow-up from there.
Absolutely.
So we're excited about
So you're
that.
talking about the whole imaging gamut as well. What type of procedures do you have that you take care of here in radiology?
Well, we have overall in imaging mm-hmm. as a whole.
Right.
We're able to perform radiography, CT, which is computed tomography, as mm-hmm. well as MRI, magnetic resonance imaging, ultrasound, nuclear medicine, PET scans. We do those as well. So we do a lot in the imaging world, and it's good that we're continuing to grow in what we can do and how we do it.
Absolutely. You know, as I'm looking around this room, I'm not a stranger to this type of equipment, because I've had MRIs done and CTs and of course with the mammograms done. When I come in here, it's like this, I feel this coldness.
Oh, yeah.
Coldness. But it's like the equipment that you have here, it's all digital now.
Yes.
Tell us about that.
Yes. Well, digital, the easiest way to explain the benefit behind it mm-hmm. being digital is that physicians are able to access those images from wherever they are. Mm-hmm. So it could be a physician on a golf course. He gets an image. He's able to pull it up on his iPad and call and give the result to where it needs to go.
How cool is
that? That's
neat,
right? And as well as in the surrounding offices, these physicians are able to access those images real time immediately after our radiologists dictate them.
Right.
Very proud of our radiologists that we have here on site. Last year, we were able to recruit Dr. Barry Parker, well recognized in this mm-hmm. community. Mm-hmm. So having him join our practice is very exciting for us. A lot of our patients love him. A lot of our surrounding physicians love him. Mm-hmm. And so that's been exciting. We also have Dr. Charles Young. He is an interventional radiologist, so he's able to do a lot of the invasive procedures, needle in the skin, and do more of a therapeutic approach to what we do. Dr. Parker also does the same thing. Mm-hmm. And the third radiologist we have is Dr. Jim Darling, mm-hmm. and he is a general radiologist, but he is very diverse in what he can read and very good at what he does, very thorough.
Absolutely.
So we're excited about our radiologist practice as well.
Very good. Now, what about the technology? The technologists that you have, and the students, you have interns as well.
I am very, very proud of our team. We have a very diverse group of technologists. Mm-hmm. A lot of them are very seasoned in what they do. I have some technologists that have been here for a very I don't like to joke in the wrong way about it, but I have some technologists that's been doing what they do longer than I've been alive, and I'm 30 years old, so I don't.
That's actually pretty awesome.
Yeah, I'm careful about who I tell that to,
right.
but our technologists, they are very seasoned in what they do, and how they're trained today versus how they were even 30 years ago. Mm-hmm. Our technologists today get a very well-rounded education before they step into the field. And but yeah, the technologists we have, the team that we have, our PACS administrators that we have to oversee the digital things that we're able to do, we're proud of our team.
Absolutely. And so statistically, if you could say now that you have 2 suites, as far as how many patients now can you see as opposed to before?
Well, to answer that question is very simple. We were running at about 30 to 40 mammos a day before we had the 2 units. Now we will run easily up to 60 to 65 a day. So by doing that, it's good that the most benefit that we see in that, again, is that patients are able to get in and get the study quicker, and the physician that sent them to us is able to get those results quicker.
Absolutely.
And then for appropriate follow-up. Because if there is something that's identified on the mammo unit or from the mammo exam, obviously it needs quick follow-up. So that's the true benefit behind it for our patients and our physicians.
And I can be a testament to that, because when I did come in and have my mammogram, seeing that it was digital and how the imaging that you saw just like that, and just the timing of it and the results, I got them much sooner than I'd even thought that I would have.
Excellent. That's what we aim to do.
Absolutely. And the team was so professional.
Good. Yeah, we're proud of our mammo ladies for sure. They're very empathetic to what they do with our patients, and without saying too much about it, we're very proud of what they do. They're excellent. Well,
we definitely want to meet those individuals that are part of the team.
Absolutely.
And we certainly appreciate you and everything that you contribute.
It's been my pleasure having you.
Absolutely.
Yes, ma'am.
Thank you, Mr. Kersey, everyone.
Chest pain can be a warning sign of a heart attack. And when it comes to the treatment of chest pain, every second counts. Did you know the emergency staff at Fairview Park Hospital has the expertise and access to the latest technology to care for cardiac patients experiencing chest pain or other symptoms related to heart attack?
Fairview Park Hospital, now the region's only accredited chest pain center with PCI.
We're here in the mammography suite with Miss Lizzie White, who is a radiology technologist here. How are you doing, Miss Lizzie?
I'm doing fine,
Now, we definitely want you to kind of show us the process of what we go through, what we women go through in this process, but we also want to find out a little bit about you.
Okay. I'm Lizzie White. I've been here at the hospital now for about 18 years all total. Been doing mammograms here for about 15 years. I started out as an X-ray technologist back in 1996, and I moved to the mammogram department, and I've been doing mammograms exclusively for the last 15 years here.
Wow.
Seen a lot of patients come and go. A lot of patients here in town knows my face. And then sometimes when I meet people at the grocery store, they go, "Oh, you're my mammogram lady." So it's kind of interesting sometimes. We get in the grocery store talking about breast, but
yes.
that's a common thing when you're a small town and you know everybody.
Absolutely. And your name is commonplace in my family.
Commonplace.
And so you've been doing this for many, many years.
Quite some time now.
Do you find there being a more frequency, especially when it comes to Breast Cancer Awareness Month, where women are more concerned about getting their checkups?
Usually during the Breast Cancer Awareness Month, starting in October, we get swamped. Really get swamped. From October to December is our busiest times here in the mammogram suite. Everybody's trying to get their mammogram done. Everybody seems to be a little bit more aware of breast cancer and breast cancer awareness. So it's on the forefront of everybody's mind. So they trying to get their mammograms done.
Right.
All of the doctors trying to get their patients in before the end of the year.
Right.
And it's just a real busy time. It's an exciting time here. And usually from October, like I said, to December, it's crazy around here. Really crazy.
Really crazy.
Really crazy.
Well, I was really crazy when I came here a few weeks ago when I was one of your patients, but just the professionalism that you and the staff showed me was amazing.
Okay, well, we appreciate you as a patient. We do our best here to treat all of our patients as family. They're not just patients, they are a family. We take good care of our patients here at Fairview Park Hospital Women's Center. That's our goal.
You treated me like I was family. I felt so comfortable. And a lot of times, when you have family history of breast cancer, you come into this environment and there's that inside, just kind of that that fear of the unknown. And, having 9 girls in my family, and several of us have had to have breast surgery from lumps removed. And, of course, you actually found the lump from my sister.
Yeah.
She did pass away, but it's so important.
It is very important.
And all of the internal emotional things that we feel, that patients feel when they're coming in here.
So you have our empathy. We try to emphasize with our patients. We understand if a patient has a family history of breast cancer, when they come in here, they're going to be a little bit nervous. They're going to be anxious. They're going to be worried about the procedure, worried about the outcome. So we try to put their nerves at ease. We do the best that we can to make our patients feel comfortable. We try to stay as professional as we possibly can with our patients and still give them that loving, kind touch.
You treated me so great. I went home. I was driving home. I called my sister. I said, Miss Lizzie was so sweet to me.
Well, I certainly appreciate you. And all of our technologists here, we all have that same mentality towards our patients. We do everything in our power to keep you as comfortable as we possibly can.
And that's so important. Being professional, but also understanding the emotional aspect of what the patients may be experiencing.
Yes, because we understand. We get patients that come in, and sometimes they're really quiet, but different people deal with things in a different way.
Right.
And when they come in quiet, it's not that they're not a friendly person or they're not concerned. It's just that they're scared. They're really scared. Once we get everything and everything's done, they change they kind of blossom into a butterfly, the different person that walks out of here. They walk out smiling.
I was a caterpillar when I came out, and surely a butterfly when I left.
Okay.
Well, show us the procedure of what takes place, what transpires during a normal breast exam.
Okay.
I'm going to step back and let you go ahead and talk us through this.
Be glad to. This is our machine. We're going to use this balloon to demonstrate as a breast. And this is a 2013 digital machine. We just acquired this machine. We're very proud of our equipment. Now, what would happen is we would lay the patient's breast here, and we would start compression. This paddle will come down on top of the breast. We'll bring it down slowly, and it just gently presses the breast. And then once we get the breast pressed to where we need it, we will step around here to the machine. And I'll walk around.
Okay.
And we'll show you an image of an actual breast.
All right.
And this is what it would look like on our picture here, an actual breast image. We will check our images to make sure we have all of the breast tissue in there. And we would do a series of pictures, about 4 pictures. We do 2 pictures where we come down, pressing the breast from the top, as you see here. And we do 2 pictures where we angle the machine and press the breast from the side of the breast from sideways. More like that, okay? And after we do our pictures, we check them and make sure we have all of the information for the radiologist. And then we'll close this exam out and send the pictures to our imaging system, to our PAC system, and where the radiologist will actually read from our imaging system. And after we finish the total exam, the patient will receive a letter from us from the results of whatever the outcome is from the mammogram.
Now, how much more convenient is it to have a digital system as opposed to the old way of doing it?
Oh man, the difference is night and day. That is the difference, night and day. With the old system, they were good machines, but like any technology, once you get something better, you don't realize how much better the new is until you remember the old. Where we used to have to run down all the way to the x-ray room, develop pictures, come back, let the patients know that everything's okay. If we develop our pictures and find out that we don't have all the information we needed, we have to come back, take more pictures, go down, develop pictures again, come back again. So it was just a little more inconvenient with the old way. But at that time, that was all we had.
Right.
So we learned to use what we had and make the best of what we had. Now with the digital pictures, we can see our images instantly. As soon as we take our pictures, all of our images show up here on our workstation. So we know exactly what we're working with. We know what we need to do, if we need to repeat a picture, or if everything on this image is here and fine for the radiologist. So The new digital system is worlds above the old system. Wouldn't trade it for the world.
And that's also an increase in your productivity as far as the amount of patients that you're able to see and the
Yes.
time management, of course.
Oh, yes. Now, whereas we used to take about 30 minutes for the whole process, now it only takes about 10. So we can get more patients in, more patients out at a quicker rate. But then we also can have that quality time that we can give the patients, give them that assurance.
Absolutely, absolutely. And having been a product of actually being a patient with this equipment, it was wonderful. It was a wonderful experience for me as a patient going through. And I remember the old process of what you had to do.
Uh-huh. And your sister probably came when we started with the old equipment.
Yeah.
So at that time, she had to suffer through the waiting while we go down and develop pictures and all of that. Whereas with you, we had you in and out in about 10 minutes. And so it was a lot quicker process for you. And we just praise our director for getting us this new equipment.
Absolutely, absolutely. Well, you've been here for a long time, Mrs. White, and we're so thankful for the many lives you as an individual has touched through your professionalism, your work ethic, and just your kind heart.
Okay. Well, I'm just too glad to do it. I love our patients. I love our hospital. And we just want to treat everybody that walks through our doors like our family. That's our goal.
And that's how we feel.
And I'm glad to have you as a patient. Glad to have you here with us to do this interview.
Hey, thank you, Miss Lizzie White, everyone.
You're
Thank you.
Quite welcome.
Thank you.
You're welcome.
Hello, Middle Georgia. Graham Slater for Dublin Ford Lincoln. Going to give you a sneak preview of our plans for our new dealership. We're investing heavily in this community because you've made us number one. And we're going to have a state-of-the-art facility that is just going to blow the competition away. Going to have all the up-to-date electronic equipment, diagnostics, any tools that the salespeople or the technicians need, we're going to have. It's going to be a beautiful facility on Highway 80 West. As you can see, there is some progress. We've already got the site work done, the curbs are in, getting ready to pave, and of course the old building's coming down. But you come see us here at our old location. We're moving cars as fast as we can, get them out of here and get ready for our move. But come and see the new dealership on Highway 80 West, or come visit us at our current location for a great deal on a new Ford.
We've got radiology assistant Kay Plummer here, who is also a bundle of sunshine with her yellow on, of course. Hi, Kay.
Hi, how are you?
Doing very well. Now, we're eager to find out about you and the work that you do here in the mammogram suite.
Okay. Well, I've been working here since 1988. I actually started working in dietary. I worked there for a few months, and then I transferred here, and I started being a radiology secretary. And I moved from there to radiology transcription, which, if everybody doesn't know, that means just typing the reports on the patients that the radiologists dictate. I have done that for several years until they downsized maybe 5 years ago, and I was moved into the mammogram suite, which I absolutely love. But the difference in doing that job and this job is when I was transcribing, it was like I was in my own little world.
Right.
And I didn't really come in contact with the patients. Well, now I have contact with the patients because I'm a radiology assistant, so I meet the patients when they come in. So it was a new experience for me. I had to put my game face on because I'm like, okay, I gotta be, hi, how are you? Good morning.
Right.
This is what I had to do, but I've come to love it. You know, it's very emotional at times because we get patients that come in and they've not had mammograms before, or maybe it's a patient that's had breast cancer and they're just anxious because they don't know what they're going to find that day. And you have to be sympathetic toward them. And my heart goes out to them. And then we have these little old ladies that come in, and oh my God, they remind me of my grandmama. So I'm like, hi, darling, can I help you fill out your paperwork? And they're like, sure. And to me, that touches my heart. And it's so easy for me to relate to these people because I'm a patient that's had to have 2 biopsies before. Didn't know what they were going to find, but thank God they all turned out okay. So I sympathize with these patients when they come in. I have 2 grown kids. One is 30, the other one is 29. Believe it or not.
She started when she was 4. I don't know how it worked, but it worked.
But All that said,
Yeah.
I love my job.
Yeah.
I love the people that I work with, and I just enjoy being here with Lizzie, Lori, and Lois. I mean, when it's like slow and quiet, you may come down the hallway and hear me laughing out loud because that's just me. I'm trying to liven everything up. But we have so much fun working together.
And you can actually tell you do because of the energy that's in here. Because when I came here, you were the first person that I saw. And you were like, hi.
I
Fill out
know.
this paperwork. And I'm like, ugh.
I know. And she had me laughing. I can't tell you what she told me, but
Yes.
oh my God. You just would not believe it. But we had so much fun in here that day.
Because it's important, like you say, to really make people feel comfortable in a sometimes very uncomfortable scenario, so to speak.
Yes. And me being a woman and have to get my girls seen about. I mean, I
That's
just
a professional term of
exactly it is.
girls.
I mean, I sympathize with you when you come in and you say, "I've never had a mammogram before," and I'm like, "Okay, well, breathe," because honestly, they're terrified.
Yeah.
So I just my heart goes out to those that haven't had mammograms before. I tell everybody, get it done. Even if you find something, come back. Keep yourself checked on because it's important. It's very important.
And not just because of Breast Cancer Awareness Month.
Right, all the time.
All the time. And you have grown children.
Yes, I do.
And you've been in this community for quite some time, all your life.
Yes, basically all my life. I was born here.
26 years here at the hospital.
Yes, 26 years.
And you've transitioned so much throughout those years. And this by far is the place that you can really find your comfort
Yes,
zone.
yes.
But we certainly thank you so much.
You're so welcome.
Because you were so sweet to me. And I'm honest when I say that I went home and I was calling my sisters and telling them just how amazing I was treated here.
We thank you.
Given
for
my
that.
family history,
Yes.
that was even more so. But you were the first person that I ran into. You were so wonderful to me.
Well, thank
And
you.
to every patient out there that has had the opportunity to be here, to come into the mammogram suite, and to partake in that kindness.
Yes.
We
well,
all thank you.
Thank you.
We are here with Miss Lois Bethay, who says that she's pretty much a jack of all trades here, and we're definitely excited about meeting you today.
Well, thank you. My name is Lois Bethay, as you said, and I live in McRae, Georgia. I have a husband named Chuck Bethay, and I have one son, 2 stepchildren. I've been doing X-ray, mammography, and CT and ultrasound. I've done CT and X-ray the longest, and mammo also since '98. I do mammograms here in the afternoons from 4 to 6 for patients that can't get here during the daytime.
Tell us about how your experience. Have you always worked in the medical field?
No, ma'am, I did not. I was a cosmetologist for 12 years, and the only other thing I wanted to do when I graduated from high school is X-ray. And I put that off for about 10 years and
10 years.
went back to school in '92. And
Wow. So you conduct X-rays, and you can do our hair and
yes,
makeup.
yes. I still keep up my license.
You still
So I just have a lot of fun. I do a little bit of everything here at the hospital. I'm based in X-ray, and I do CT a few days a week, and then mammo in the afternoons from 4 to 6. I just kind of like a permanent floater. I go wherever I'm needed.
And how many patients do you generally see a day?
Oh, anywhere from 10 to 20, 25, just according to what the schedule's like that day.
And with the change in the equipment, has that been a lot for you to have to process in order to adjust to the change of the equipment?
Yes, ma'am. As I'm getting older, it takes a little bit longer to process and keep everything in line. But it is a lot of information to remember from different modalities every day to, how to do the procedures and the paperwork and all.
But you definitely see an increase in
Yes.
productivity.
Yes, ma'am, especially in mammography with the digital. I couldn't believe I had just started back doing the latent mammograms here a couple of years ago, and I couldn't believe that we could do patients in 10 minutes when it used to take 30 to 45 waiting on the film to develop and all. But I was like, there's no way you can do 10
Yeah.
10-minute mammograms.
And you
I don't
can.
believe it.
It's
and
amazing.
you can, and it has really amazed me.
From the old times when you had the huge screen, the films,
Yes.
and you tell us don't breathe
Don't breathe.
for like 2 minutes.
Exactly.
And now that time has changed, and it definitely has helped with a whole lot of things.
Time, yes. We can get more patients in. Patients don't have to wait as long to be seen. And I just love it.
And how do you keep your positive attitude? Because you have a really good personality. I just noticed that.
Well, I just love taking care of patients and seeing about patients. Anything I can do to make someone's life better, or
You're doing it. You're doing it. We might call you for you, like, do my hair or something.
oh, I'll be glad to.
Lois, thank you so much. We certainly appreciate everything that you do around this hospital and in the community.
Well, thank you. I appreciate HCA and Fairview Park for allowing me to be an employee and take care of people.
Absolutely. Lois Bethay, everyone.
Welcome to Pitts Toyota, downtown Dublin, where people go to buy great cars at great prices. We're a family-owned and operated full-service automobile dealership, serving Middle Georgia since 1947.
Hi, my name's Nick Camerata, General Manager of Pitts Toyota. I've been with the Pitts team since 2009. It's our promise to provide you with an enjoyable, stress-free shopping experience. We have a full-service website that's fast, convenient, and easy to navigate.
Hello, I'm Steve Winter, Sales Manager here at Pitts Toyota. We provide a balance between the big city selection and the warm, familiar atmosphere of a hometown business.
Hi, I'm George Key. I've been with Pitts Toyota for 34 years. When you come into Pitts Toyota, you'll be greeted with a sales staff who are knowledgeable, caring individuals, and our only goal is to satisfy you.
Toyota, let's go places.
And we're here with Lori Sumner, who is the mammographer here, and it's so exciting to see you here.
Thank you. It's good to be here. Good to have you here.
Tell us a little bit about yourself, and we want you to share a little bit about your personal story that's really going to touch the people out there.
I'm Laurie Sumner. I'm married to Chris Sumner, the manager of Farmers Furniture, and I've been here at the hospital for 15 years. I've been doing mammograms for the last 7 years. And also, I'm a breast cancer survivor, 2 years in July.
Wonderful.
Yes,
We're
ma'am.
clapping for you right now. Now, could you tell us about the process, that what you went through, and what makes you be able to empathize and sympathize with the patient that you see?
Well, you know, most people that come in here, they say that you say that you can relate to them. Well, I really can relate to them, and I can really have sympathy for them and empathy. And it was just actually a blessing for what I do to go through breast cancer and be able to help my patients. I can honestly say it was a blessing.
And we're so glad to see you here. You're healthy.
Yes, ma'am. Yes, ma'am.
And now what you do here with these ladies, for you to have experienced breast cancer yourself and to be able to really sympathize with the ladies, how long was your journey?
My journey was over a year. I had to first go through chemo, and I lost all my hair, and then I went through the surgery with a lumpectomy, and the only thing bad about that whole situation, I knew one of my lymph nodes was positive. I didn't know two of them were, so when I had the surgery, it was two of them that were positive. But that also was a blessing because it answered the question of if I wanted to have radiation or not. So I knew, me as being as young as I was when I had it, that I was going to have radiation. So I also had 32 treatments of radiation.
32 treatments. Now, how old were you, if you don't mind us asking?
I was diagnosed December the 2nd, right before December the 9th is my birthday, a week before I turned 50. So I was 49.
49 years old. And how important, we want you to definitely give a special message out there to the ladies about how important it is early detection, and to make sure that we're consistent with not only checking our breasts ourselves, but also getting the breast exams that we need to get each year.
I'm very, very passionate about this job. I just absolutely love my job. I love taking care of the ladies, and I cannot tell them how important it is. We cannot keep you from getting breast cancer, but we can surely catch it early enough that it does not have to take your life. So it is very, very important to have your mammogram every year, and every month do your self-breast exams. Even if you don't have a cycle, please pick a day to do your self-breast exams every month, that you know that you've got to do that. And buddy up with somebody. Buddy up with somebody that lets you be responsible and say, hey, did you do that this month? And also with your mammogram. Hey, have you had your mammogram this year?
Absolutely.
It's very, very important.
And outside of your work, what do you do to advocate against for breast cancer awareness?
I do the breast cancer walk. Anybody that I come into contact with, that's the first thing I ask. And most people who know me know that I went through that journey, and they know where my passion is. And I've already had my mammogram this year. You don't have to be on me, But that's another thing we do is make sure that the people that we know and come in contact with, hey, have you had it?
Absolutely. And as far as self-care, what can we do? We know about family history, and of course, if you don't get your exams, but what things can we do that we should look out for as far as self-care that would help us in? I remember I went to the doctor once before, and he says, "What about your caffeine intake? Are you intaking a lot of caffeine, because that can cause a lot of issues with fibrocystic breast?"
That sure can. It doesn't cause it, but it definitely makes your breast real sore. You can do vitamin E. Vitamin E is absolutely awesome for your breast tissue. Do your self-breast exams every month, and like you said, watch your caffeine intake, watch the foods that you eat. People don't realize it, but what you drink and eat has a bearing on what your breast tissue looks like.
And what example of that can you tell us?
The caffeine, the hormones. If you take in a lot of caffeine, then that of course causes the breast swelling, the breast sore. Eating chocolate, that's exactly right. Eating chocolate is not good for your breast. Smoking is horrible for your breast tissue.
Right.
All of that has a bearing on the fibrocystic.
Well, to have your knowledge as far as your personal experience and then what you know medically, to have you here at this facility is truly a blessing.
I love my job. I love what I do. I love being here, and I appreciate Fairview Park Hospital. We have a wonderful, wonderful hospital to serve our community.
Absolutely, and we're glad to be here to be a part of that.
Thank
you guys. That's all the time we have for you all today. Fairview Park Hospital, we are grateful for you. We're grateful for everyone that's a part of it, especially, of course, in the mammogram suite, the work that you all are doing, the self-care, and especially the personal care that you give for your patients.
Oh, thank you.
We appreciate you all very much. That's all the time we have for Real Talk, and ladies and gentlemen, please keep watching.